Hello and good morning, everyone. I hope everyone's well. My name is Rajesh Agrawal and I'm the Deputy Mayor of London for Business. It's great to see so many of you joining us this morning to talk through the workplace testing options. And we are very pleased that we've got Ben Stimson with the NHS Test and Trace who's joined us. So good morning, Ben. And before we launch into the presentation, I want to first briefly touch on the overall picture for London. There has been great progress with the rollout of the government's vaccination program. As of recent figures, we are approaching an impressive number with 3 million people being vaccinated in London and over 25 million across the UK. I'm also incredibly impressed and grateful for all that the businesses are doing to help us overcome this virus. Coronavirus has forced organizations and workers in every industry to reinvent themselves, adopting to new working environment. The resilience that many businesses have shown makes me so proud to be the deputy mayor of the greatest city on earth. Though I know that many of you are facing challenging times, but the mayor and I remain fully committed to do everything we can to help businesses emerge from this pandemic. So we've got the London Business Hub, which brings together a non-biased offer of support, advice, programs and events for businesses from across London. The purpose of the offer is to provide a one-stop shop for business support. SMEs have got access to a number of free programs, such as the property advice service, where you can get advice on the business rates and landlord negotiations, investment readiness for businesses looking to raise finance, as well as many others. There are also advisors available for businesses looking for bespoke support to achieve their business goals. All of this information is available on www.businesshub.london. Early in the pandemic, the mayor launched a COVID-19 support hub for small businesses. This is also updated regularly with advice, information, and guidance to support businesses through the pandemic. So if you haven't checked out the hub before, I would encourage you all to do so. I'm working, as is the mayor, with the businesses across London to ensure that they are ready for when the further restrictions are lifted. The mayor has also committed £5 million to the reopening of central London, including a brand new drive to attract visitors back to hard-hit retail, hospitality, and cultural venues and events. Alongside vaccinations, of course, testing is our key route out of this pandemic. And I know many of you have questions about what options might exist for your business as we reopen our economy in the coming weeks and months. I'm so pleased that we are joined this morning by Ben Stimson, Chief Customer Officer at NHS Test and Trace, to talk through the suite of testing options which are available to businesses regardless of the size. Ben will give us a presentation with slides and then we'll open it up for questions and answers. So please be thinking through your questions, any questions that you may have, and we'll try and get Ben to answer those questions. A bit of housekeeping for start. Please do full make use of the chat box functions and pop your questions and comments in there, and we'll come to those after Ben's presentation. And when posting in the chat box, make sure you select all attendees so everyone can see your message, because I've made this mistake before. We'll also be recording this session and uploading it to London Business Hub. So if you want to refer back to it or share the content with your networks, you can do so. So I would now like to introduce Ben Stimson, the Chief Customer Officer of the NHS Test and Trace. Ben, over to you.
Thanks, Rajesh, and thank you so much for having me and giving me the chance to share with you, as you say, what the options are for businesses on testing in London. Just very briefly, as a man who has a title that people often wonder what a Chief Customer Officer does, just to briefly tell you about myself. So I joined Test and Trace 6 months ago. As you all know, Test and Trace itself is only a year old. And I joined from the business world. So I used to work in Waitrose and John Lewis, and prior to that in Sky Television. So large organizations, but I am coming at this from a perspective of how do we make sure that what Test and Trace offers is right for the customer, whether that's the end citizen or whether that's yourselves as businesses whom we need to work with to make sure that we make it possible to keep your workplaces safe. So if I can move on to the first slide, I wanted to start, if I may, with just a little bit of an update on Test and Trace so far. And as I said, an organization that's a year old, and that when it began had the capacity for something like 2,000 tests per day. We've now moved to a place, and in fact, we've just crossed the threshold of carrying out 100 million tests across the UK in terms of tests carried out for coronavirus for individuals across the country. So to move from a couple of thousand a day to what, in terms of PCR testing, so the type of testing where you go with symptoms, we've now got a capacity of 800,000 tests a day. And if you look at the comparisons internationally, what the UK is offering in terms of the level of testing, which is the right thing to do for citizens, but also enables us to manage the virus as well. It is on a scale significantly above certainly any other European country. The other number I wanted to just call out in terms of amount of testing is the call out there on the number of tests we did in schools and colleges last week. So that just over 6 million tests. The rapid tests, which I'll come on to talk to about a little more, we carried out just over 6 million in schools across the country. And that's enabled us to find positive cases where individuals don't have symptoms, and is an important part of keeping schools open as kids return. To call out a couple of other of the many numbers on this slide, we have got a tracing service. So testing is of course part of the important start of the journey, but what happens next in terms of ensuring that we contact those related to the case and that we do that swiftly so that they can then act and isolate. And we're reaching ahead of the target that SAGE set for us in terms of reaching 89% of contacts of the original case. And that's over 9 million people, the original cases and their contacts that we've traced through the past year. And the app is similarly a digital tracing tool. So an extraordinary, just over 20 million downloads have taken place of the app, particularly in a business context. And for those of you in the hospitality industry, thank you for what you've done to enable the app to be used to check into locations. You can see the QR codes there. You can see the number of check-ins at over 100 million that we've had since that was launched. And obviously lockdown, much less in use, but will be an important part of emerging from lockdown. And we've got a study that shows the app in and of itself prevented 600,000 cases of COVID, precisely because it's so fast and so quick to alert people to the fact they need to isolate. The R rate is on a downward trajectory, as we all know, and continuing to keep it there using this very large scale of testing and tracing is a really important part of what needs to happen going forward. Just to flag as well, local authorities and companies have been absolutely crucial to enabling us to test at this scale. So local authorities have helped set up community testing sites, which I will come to a bit more fully in a moment, and working with a number of local parties to make sure that testing is in the right place for the communities that we are serving. And similarly, as you can see there, over 50,000 companies have now signed up to be part of workplace testing. And the bulk of what I wanted to talk about is how that workplace testing works. And as Rajesh said at the beginning, what the options are available from you. And I will shamelessly say that I will end with an ask, which is to sign up to be part of the workplace testing program that we're running. So I hope that's helpful just by way of an update of Test and Trace more widely. If I now come on to workplace testing specifically, let me just put it in context in terms of testing, asymptomatic testing overall. So during lockdown, we've been testing particular groups of people. So those at high risk, those in the NHS facing staff and patients, those working in adult social care, and particularly for those attending school and university during lockdown. And similarly, there's a really important piece here in terms of testing for variants of concern to make sure we stop very quickly should any of those be found. We've then, as I say, with your and many other businesses' help, expanded workplace testing during the lockdown period. So for those workers who have to leave home to go to work, ensuring that there is testing available for them to ensure that they can work safely. And then from the 8th of March, which already seems a while ago, but it wasn't really, from the 8th of March, when schools reopened, schools testing at scale, as I've talked about already, and for the households and those that support schools to also be able to get access to rapid testing as well. And then as the slide goes on to say, as we emerge from lockdown and as we follow the Prime Minister's roadmap, that will enable us to expand testing in parallel with that. And there's a really important bar along the bottom of this slide. So all that I've just talked through is about testing for those without symptoms, about making sure that we find the virus even where people don't know that they've got it. But along the bottom, as it says, those with symptoms, the offer of continued PCR testing remains and continues. So workplace testing at the moment is in the context, as I say, of expanding it to make sure that it serves those who have to leave home to go to work. Many people, of course, are able to work from home, and that has enabled us to focus particularly on those having to leave home to go for work. So if we go on to the next slide, there's a couple of ways, three really ways in which workplace testing is available to employers. The first, and I've touched on this briefly, but it's community-based testing. It's led by local authorities, and usually for smaller businesses, or where workers are particularly mobile, having access to community testing sites is an important part of the offer to business. Those are available until the end of June, and it is possible to find them on a site finder on the .gov website if anybody needs to locate community-based testing sites. Similarly, we have workplace testing taking place. We've got just over 1,300 firms who've got test sites set up within their workplaces, and that is enabling organisations to test employees who do need to come into work for any reason. The funding for that is in place until the end of June. There's a really important point in here, and I sort of, on one level, apologise for it, but want to flag it really clearly, which is that in order to get access to the free test that we're providing, it's important to have signed up by the end of March, which isn't far away, I know, but it will continue to make an organisation eligible for the free test until the end of June. And I think particularly for those of you in sectors whose businesses are currently not open, important to, as I say, to stress the need to sign up to have access to that as different sectors of the economy reopen. And then lastly, in terms of what I want to talk about for workplace testing, at the bottom there, you can see what's called home collect testing. And we are currently piloting the ability to test at home for employees. So to collect the kits in the workplace and for the employer to play an important role in distributing, but for the testing to actually take place at home. And if for those who work in sectors, I speak from the one I came from, the supermarket business, where sites tend to be smaller, actually the opportunity for employees to test at home in parallel within larger sites having symptomatic testing, our pilots are showing that that is helpful, and I'd welcome any comments on that and any perspectives when we get to the Q&A. If we move on to the next slide, please. Very briefly, because many, I'm sure, will have seen or heard about lateral flow tests. So these are the rapid 30-minute tests on which all that I've just been talking about is based. They are very, very significantly important for two reasons in a business context. They're important in other contexts as well, but just for this audience. They are very good at helping to detect people when they are most infectious. And self-evidently, that is the point where in the workplace, the risk of transmission is highest. So they are detecting over 95% of individuals when they're at their most infectious. The second reason that they're so important in a workplace context is that they have what in the jargon is called a high specificity. So what that means is you get very few false positives. About 1 in 1,000 will be a false positive. So 1 in 1,000 will say someone has got COVID-19 when they actually do not. The reason I think that's important in a business context is clearly false positives are, in this case, one individual in 1,000 who would not be able to come into work, but the other 999 would be. And it's the accuracy for the 999, for those of you running businesses, is important. The 2 tests per week, which are flagged on there, is another important part of this. So all of our evidence shows that habit of testing twice a week ensures that we pick up the majority of the cases. And actually you find more cases by doing the regular testing than you do. I've been asked previously, couldn't we do once a week? You can, but at this stage, twice weekly detects a significant amount more of the cases. You can see on the right-hand side there a number of URLs, which we'll definitely make sure are circulated afterwards. But that shows you where it's possible to sign up to participate in this. It also talks about the materials that are on offer there to ensure that you can communicate it to your teams and your workplaces. If we move on again, just to share some comments from those who have been using workplace testing so far. And I recognise, particularly for those of you smaller organisations, these are large businesses. And of course, there will be different experiences based on size of organisation, some of which I can see coming in the chat, which we'll definitely come back to. But John Lewis, who's been testing this, has tested 45,000 employees and points to the lower cases, the lower absence that this is driving. Similarly, Tata Steel, saving of thousands of pounds because they've avoided stopping production lines because they've identified cases earlier. And Octopus talks about the benefits in terms of the staff morale, the staff feeling that the employer is supporting them. And I've certainly heard this from a number of organisations I've talked to, that focus on workplace safety, of which testing is a part, has been a really important part of what companies have done. If we go on again, it's a simple process in terms of what your staff need to go through. And some of you I know will have already tried this, but a very simple registration point initially. Scan the barcode of the lateral flow test, take the test, which I'm afraid isn't the most pleasant of experiences, but in workplaces there is training to make sure that those helping staff to do it can make it as straightforward as possible. And then a result comes through within 30 minutes, and that result is texted to the phone of the employee. So it's a quick process and one that enables then business to continue. So the final slide, I think, in this pack was to, as I said, unashamedly ask for support from you. And as Rajesh said at the beginning, this is one of those extraordinary situations where it is by a combination of us working together to reach as many employees as possible, to get testing at this scale, that we genuinely will be able to manage the virus going forward. So the ask there to sign up, it is, as Rajesh also said at the beginning, our testing is available to businesses of all sizes. Previously, some of you may have heard there was a threshold around 50 employees. We have removed that threshold. And similarly, if it is more sensible for your business to use community testing, that, as I said, remains available as well. There's a piece in terms of engaging your workforce, the tone you set around this. It is entirely voluntary, both for the business to do it and for the members of staff to take place. But our experience is when the tone is right, as I said, employees see this as a benefit to support them. And finally, this is about planning ahead. So as the vaccine rolls out, it is easy to say that perhaps that will solve all of our challenges with the virus. And I know we all hope it will. And indeed, the scale and speed of the vaccination program is truly impressive. However, one thing we also know is that the likelihood is with the vaccine in place, we'll have more asymptomatic cases, more people not showing symptoms. And we don't yet know whether the whether the vaccine stops the virus from being transmitted. So until we know that, planning ahead, ensuring that we've got this twice weekly testing in place for as many citizens as we can, and particularly in this context, those in the workplace, is truly critical to helping us manage the virus going forward. So Rajesh, thank you. I hope that's helpful to set the scene, and under your guidance, happy to answer questions as best we can.
Thank you very much, Ben. That was very useful, and it's great to hear the latest updates hot off the press, so to speak. And I can see a number of questions that have actually come through. So if it's okay, I'm just going to sort of take them in the order. Maybe we can take a couple at a time. Because so Helen Clark Bell has asked, do we know how many cases have been passed to test and trace through the use of the QR code at venue check-ins? And Cal asks, workplace testing. How does a business register if you're not registered in England with Companies House?
So on the app and the number of cases passed to test and trace, which I think how the question was phrased, one of the strengths of the app in terms of its adoption and its usage is that it is entirely anonymous. So we centrally do not have any view on which cases, who has cases recorded in the app, and to be able to link that to any tracing. So the straight answer is I don't know how many have been passed. I know in total the level of cases found, which was on my initial slide, and there is a results reporting function in the app. But in terms of the link between me as an individual and the what's on my phone and what we at Test and Trace know, it is not possible for us to know that. On the point around registering, as I think, I'm not sure if it was as a non Companies House registered organisation. We'll have to check that, because as I think you're alluding to, the sign up process requires the Companies House registration. But do pop in the chat or come back if I'm misunderstanding the question.
That is a very important question, Ben, and actually it has come time and again. I can see in the number of questions. If you are a registered partnership, for example, and you're not on Companies House, then how does that work? Now, next question is from Claire Jackman. Will there be an opportunity for small businesses with under 50 employees to be sent tests to do on site? And then Jamie Hartridge asks, how do we sign up to be involved in the home collecting testing pilot?
In terms of size of organisation for home testing and the pilots, we've got a variety of organisations testing it for us at the moment. It's only 10 in the pilots, I hasten to add, before people feel they've been excluded from the piloting. We simply wanted to make sure we understood what the implications are for an employer, actually, as much as anything, of managing this. So when the testing moves into the home, the employer obviously loses visibility of the tests that are taking place, and how we help the employer to manage that is an important piece. It's absolutely more convenient for many businesses. I completely understand that. And as I said earlier, we are looking at, and I'm expecting to be able to come back relatively soon with more information on how we'll make home testing more widely available to employers as part of also testing on site. So the idea of being a kind of a mixed offer, and businesses being able to choose the combination of community testing sites, home testing, and on-site testing that works for their particular type of business. The final thing to say is that it is equally, while I completely understand the convenience of home testing and indeed the practical necessity in some smaller organisations, there is very clear evidence that test results are more reliable and more accurate if they are done under supervision effectively. So in community testing sites or in sites at employers. So we need to be careful. While there are definitely convenience benefits, if we come back to the fact this is a medical problem we're trying to solve and transmission we're trying to break, we have also got to make sure we've got in place the right methods to detect the disease.
Thanks, Ben. Again, next two questions very similar to sort of what we've talked about. So Nikki Fisher asked, can you let me know why I'm unable to get workplace testing for my 9 staff, because we are a partnership and not a limited company, so cannot sign up. Darren Cox asks, we've signed up for the testing scheme, but as Lloyd's is not registered at Companies House, we've hit a bit of a wall and have not heard anything since the beginning of March. So again, both linked to how the sort of registration process is linked to the Companies House, which obviously a lot of businesses feel excluded from the process.
So as I said, let me take that one away. Our goal, as I'm sure you heard from me loud and clear, is to get the testing taking place for as many citizens as possible. So a barrier there is not our intention. And let me take it away, and I will make sure we come back, Rajesh, with how we're going to respond to that.
Thanks very much. Matthew Sims asks, given the roadmap and the timetable, is there an opportunity to extend the deadline for workplace testing signups beyond 31st of March? The communication for access for business of under 50 has not been as high profile as it could be.
So we are ramping up the marketing over the next 2 weeks, precisely because the deadline is looming. So I hope that the visibility of it, particularly to companies under 50, will increase, and certainly the scale of marketing I've seen that we're planning, I think will achieve that. At the moment, there is no plan to extend the deadline. And for those of you who are in who work in businesses very focused on sales, there's sometimes something about a deadline that focuses the mind, and so there is a desire from our end to say, let's make sure we get as many focused on getting signed up. The registration process is very light touch, apart from the challenge that you've raised with me around companies that aren't registered at Companies House, but it's light touch to sign up. So I don't think we are asking a significant amount at this stage. I'm very aware that for businesses that are not currently trading, this may not be top of mind. So we've made it as modest a step as we can at this stage, prior to the 31st of March, and then it will be about activating it once your business reopens.
So can I urge all the attendees to make sure you register and also spread the word? It's like Ben said, it's a very light process to register. Very quickly, takes a couple of minutes. A number of people have also asked if they can receive a copy of this deck after the call. Yes, I've been told. We're very happy to share the presentation. Again, another question around the deadline for 31st of March, which Ben has just answered. Julie Tower asks, they've registered but heard nothing back. How long does it usually take before you hear anything?
So if you've registered online, it should be a relatively swift process, as in all of the documentation, including the agreements that need to be signed, including, as I said, the marketing that needs to be, or that can be downloaded. And then once approved by us, there's an order form to request the number of tests that are needed. It sounds like, from what you're saying, that the approval our end hasn't happened. And if you can just, after this, if we can just find a way through the organisers for you to get me an email address and company name, I'll make sure that that's chased up. That's more often than not where I have had companies raise with me the process seems to slow down. And there are a variety of reasons why we would not have approved, but they can normally be addressed fairly quickly. And so if you just can get the details to me, I'll make sure that's picked up.
Jay asks what happens after the free funding at the end of June. Then we've got David Banks. Is there less degree of accuracy with home testing versus workplace testing? I suspect you've answered that it works better under supervision. Where do employers register for the workplace testing scheme? Again, it was on the presentation, but colleagues would also share the link in the chat as well. Another concern by Helen is I'm registered as a small business, but concerned that all communications would go to my registered company address, which is the company secretary. Often there is like an accountant or a company secretary rather than the actual office. I'm not sure what is the answer to that, really.
So that should not be an issue. So where the registered address is, as you say, something held by an accountant, but the premises out of which the trading happens is somewhere else, that should not be an issue. We and certainly in terms of delivering the test to wherever the company is located, that's very doable. So that isn't an issue. if you find it is, then again, similar ask, just find a way through the organisers to let me know. And what I would say, and genuinely acknowledge, and I can see some of it coming through in the chat, is that this scheme is, no one in the world has tried to do a scheme of this scale with employers. And so we have set it up very fast. It's improving all the time, but it needs the comments from businesses like this and the conversations like we're having now, so that we can make sure we keep improving it and make sure that it works. Rajesh, is it worth just jumping in on the question about what happens after June as well?
Yes, please.
I mean, I wish I knew what would happen with COVID after June is probably the sort of slightly cheeky answer to that point. But the more practical answer is that at the moment, and assuming the disease carries on the trajectory that the pandemic carries on the trajectory that it's on, we are expecting that through the period of June, this intense level of testing is going to be needed, and that's why we're supporting the free tests. As we get nearer to the end of the roadmap, it will become much clearer whether the period over the summer will be a relatively low prevalence of COVID-19, and therefore a need for less regular testing. So it's my answer really is that we're going to have to judge it nearer to the time. It's why we've set the timescale around June. But it's also why I'd encourage, and I had that line at the end around thinking ahead, it's also why I'd encourage that while that June is quite a lot that will need to go right to make sure that we keep the pandemic under control, in order for us then to make, I hope, different decisions about the level of testing we need in the second half of the year. But at the moment, intensity now, and then a decision in June about what happens thereafter.
Thanks, Ben. Harriet Wheeler asks, we are a HE establishment in London Bridge with higher education. I'm clear on how to organize testing for our staff, but I'm struggling to organize for tutors and students. And then we've got Matthew Sim, agree on the real figure of accuracy levels, but do see a challenge with the perception of the accuracy levels, many feeling the tests are generally inaccurate, and how do you intend to solve this?
So on Harriet's question on as a higher education establishment, assuming you're doing testing on site, my understanding and I guess expectation is that testing is available for all staff, and that would include tutors, so not necessarily contractors, so not necessarily employees, but those on the site, and similarly for students. So I'm not clear why you're experiencing the back and forth between DfE and the council. I'm very happy to try and pick up the specific afterwards and get our HE team to support you in resolving that. But it's certainly not my understanding of the model we have intended to create, which is that all those on the site, the HE site, are getting tested through an on-site testing scheme. On the question around the accuracy levels, and I think the point is there a perception issue here more than a factual issue. I think this is again an example of where the tests have, this is a new technology. It's a technology that Test and Trace effectively sponsored through an innovation program towards the end of last year, and then has emerged at an extraordinary speed and scale, particularly from the start of this year, and has had media coverage on both sides of the equation, really. So we are keeping going on the question of perception, keeping going on both the facts and figures cutting through, so my 1 in 1,000 point, and similarly on making sure that a series of very respected, far more expert in this field than me, medical voices are stepping forward and explaining why these tests are an important part of our response to the pandemic. And you will, I hope, continue to see through the media, through marketing, messages that make very clear the medical establishment's confidence, or the public health establishment's confidence in what these tests offer.
Thanks, Ben. Nicholas Salmon's questions is actually quite relevant with a lot of people's mind. Can you confirm what workplace testing is only available for staff who must attend the workplace. We will be making office attendance optional, and understand that this means the workplace testing is not available to our 800 or so staff. Is that correct? And then Hannah Thompson asked, if we are procuring tests privately, can we still encourage employees to register the results of their tests via the government website? What if they don't have a barcode?
So on, sorry, Rajesh, can you just go back to the first question? Just remind me again.
Yeah, it's from Nicholas. Can you confirm that workplace testing is only available for staff who must attend the workplace? Because we'll be making office attendance optional, and understand that this means that the workplace testing is not available to 800, because increasingly a lot of businesses are making sort of coming to the office optional, or fewer times a week, for example. So is it only for staff who are attending 5 days a week, the office?
Yes, sorry, rusty memory. It only lasted a minute. So yes, in terms of the offer, it is for those who have to leave home to go to work. And the reason for that is because the current government guidance is that only those who have to leave home for work should be doing so. So that's why the offer matches the current government position. If that changes, or when that changes, which at the moment, my understanding, it's in the roadmap to potentially be changed in June, assuming lockdown continues, or emerging from lockdown continues as planned. At that point, and a bit linked to my earlier points about we'll need to see where the pandemic is in June, we will be able to make a judgment as to whether this is something that should be offered for those who are coming optionally into the office as well. The only other thing I would say on that is that there are a number of organisations who've made a point to me slightly differently, which is I'll take a construction site as an example. If I'm a construction site that's still working and I have a combination of people on the site, so employees, contractors, that the testing I would encourage is by site rather than that it is by employee who actually is employed by whoever's running that particular site. So I think there's the flexibility there, but the caveat is that the offer is for those who have to leave home for work, because that's in line with government guidance. On the second question, if I've understood it right, so there is a barcode on every lateral flow device that is issued by us, and so that registration should be straightforward. There are also private providers of tests, which there are a variety in the marketplace. It's not a very large scale, but they will have, at the moment, they will have probably different types of labels and barcodes on them, and we are working, and this links to what's happening after June as well. We're working on how we make sure that the private sector provision of those tests matches up with our systems to be able to record those. And similarly, the private sector provides only the highest quality of tests so that employers are using ones that genuinely detect the virus.
Thanks, Ben. A number of questions now around sort of home rapid test kits, etc., which you have covered already. So we're going to whiz on to a couple of other questions. James Ross is asking, what practical and logistical steps should businesses consider with workplace testing? And Lisa Wild is asking, if your business is planning to return to the office in September, is there still any value in registering by the 31st of March deadline?
So on the second question, the any value in registering, my advice would be I would register, because as Rajesh said, it's a couple of minutes process, and because the world ahead of us is somewhat uncertain, I would encourage that sign up is worth doing. Although as you're rightly alluding to, at the moment there isn't an offer in place for September. On the first question around the practical logistical steps that need to be taken. So the first thing to say, and I should have said this much earlier rather than 45 minutes into our conversation, but the first thing to say is that in any workplace location, clearly all of the other aspects of COVID safety apply. So social distancing, wearing masks where appropriate. So this testing is not in place of, it is in addition to. The actual setting up of testing on site requires clearly a small amount of space dedicated to it. There is online training for a member of staff who will need to supervise the testing that takes place. And then there is a degree of separation while the testing takes place as well that's really important. I would describe it as not it does require some changes to make it possible to set up, but it is not. We've been looking at how we strip it back to make it as simple as possible. Once I think the sort of from businesses I've seen, once the sort of rhythm is in place, employees get used to the testing a couple of times a week as they arrive. It becomes more straightforward, and clearly the sort of skill of actually carrying out the testing yourself and the registering it online becomes more straightforward as well. So initially, I would say the setup and the preparing takes time, and as I said, the engaging with staff so they understand why we're doing it. But then overall, it starts to move quite quickly. And I would encourage us to recognise that you can move through that initial logistical barrier quite quickly.
Another question, Ben, which has been asked by Jacob McLaughlin, is which something that a lot of businesses are considering. They're staggering as the employees come to the office. So they might have a set of employees coming this week and the other set coming the following week. So Jack's question is, if a workplace has 100 employees, for example, and all 100 employees, do we test all 100 employees twice a week, or is it 50 employees one week and then 50 next? What is the recommended testing?
Good question. My advice would be that you are at the moment, you will only be able to test them when they are on site. So you're effectively doing the 50 that are in on that given week, and then the 50 that are in the following week. Where I hope we can get to is a place where, as we were talking about with home testing pilots that we're running, if we take your organisation and the way you've done the week on, week off, week in the office, week out of the office, probably a better description, we would then be able to place to say there's actually a mixed offer here, mixed model. So you test those employees who are working from home in that given week from home, and those in the workplace. So that's part of the reason we wanted to pilot it, to exactly pick up some of these kind of ways in which organisations that have to have employees in the workplace are working.
Another question from Leah March, which is again quite relevant, something came to my mind. We manage a co-working space. Is there an option to provide our members COVID testing when attending the facilities? They are, of course, not our employees.
So I think the question of whether the testing is available for visitors to sites. So I tend to take this into slightly pragmatic groups. So where you take the group I was describing earlier, where effectively there will be visitors to construction sites. Some of them will be contractors, some of them will be inspectors. My view is that those should be considered as part of the on-site testing regime. What we have not yet proposed or put in place is when, for example, hospitality reopens, a regime that says that you would test those arriving to stay in a hotel or those arriving for coffee in a cafe. Still being looked at, but not at the moment part of our proposal or our scheme to test visitors in the second sense.
Thanks. I'm just going through a number of questions. A lot of them you have covered already in a lot of different ways. Another question which has been asked by Brett Gaskin is there clear information available regarding waste streams for businesses who would take this take up this testing? Example, healthcare waste for businesses who don't usually handle this kind of waste.
Yes, so I've found in my 6 months in Test and Trace that I've discovered a number of unexpected specialist topics, and this has actually become one of them. In previously, and that may be where your question comes from, previously it was treated as medical waste, and that was complex for businesses to remove. there is new guidance which is now in place, which is the waste from the testing can be bagged up, left for 72 hours, and then put into the general waste. So it's simply the 72-hour wait, and then it can be thrown away with the remaining waste. So it's less complex. For those who got involved in this early on, they were rightly saying that this was tricky to do, and local authorities were finding it hard to get the level of collection. But this has now solved that problem.
There's also a suggestion from Maggie Burham saying many staff working in jobs such as sustainment and waste management, parks, etc., do not use email and may not have English as their first language. Will the registration process be simplified? I understand people can sign up to open an NHS account. However, this can be a barrier to staff. There's a question from Mohammed Hussain. Can London Business Hub on guiding businesses to create a policy for workplace testing, or perhaps having a FAQ that businesses can download that is in line with the government guidelines? I'm assuming there would be an FAQ available on the website. The colleagues will be able to put up a link. If it's not, I'm sure they'll work towards getting that done. Have you got a link for the video for testing? Asks Nick Baker. I'm sure my colleagues will put up the link if there is one.
And just to say, there's in the back of the slides, I didn't present it, but there's a series of links which include the videos. So I hope that will be helpful for everybody. And on the languages point, so a fairly high proportion of our services are translated into, last time I checked, it was 13 different languages. So the app, for example, is multi-language. A number of the web pages where the individual inputs the results are multi-language. The employer registration is not. Wendy
Lawrence asks, when procuring tests from private sector suppliers, how or where can we check if they're genuine to necessary standards?
So very good and important question. So at the moment there is a list that we hold, but it is actually a very short list of tests that are approved. They have to go through Porton Down, our testing standard, and meet our testing standard, and it's a relatively small number. It is quite challenging for companies at the moment because there are a few providers often referring to having a CE mark on their product, but that is a different thing to whether it has met the approved list in terms of detecting COVID-19. So we can, after this, ensure that there is that list. There is more work going on this as we speak, and I think we have an important role to make sure that businesses have real clarity of information around the quality of tests, and that is continuing to be worked on. But I will get you the list as we have it.
Thanks, Ben. A question from Andrew Kirk. Ben commented and used the example of a construction site and stated testing there would be best done by site. Is there a way for a location or site to register for testing kits, as opposed to one sort of central location, number of sites?
So it needs to be by business, or at least let's say by organisation. Once we've hopefully sorted out those who are not registered with Companies House, but it needs to be by business or by institution. And usually we would send the test to one location, and if it's an employer with multiple sites, ask the employer to distribute. If it is a business with, let's say, 3 large sites, I have said previously that we will look at whether we can make it more straightforward by distributing to 3 separate addresses. But generally, and a bit linked to the earlier points about moving with speed, the more simply we can get the test to you and then use your internal networks to distribute, the better and the faster it will be.
And final question, and I think a good segue, is there an expiry date for the tests?
Another one of the specialist topics I've developed over the last 6 months. So they last for 48 months. So they have a very good length of life. And it's the other reason to say, in terms of looking forward, there's not a high degree of product which in business terms will expire in the near future. They have a very reasonable length of life.
Thank you, Ben. I mean, there were a number of other questions, but a lot of them you have covered already. So I would suggest some of those questions, whether it's the sort of employee threshold and number of other things, I do recommend, especially people who have joined in a bit later, is that this whole session has been recorded and it would be uploaded on Business Hub website. So do look it up. We'll put the link to the website now in the chat, and do look it up and share that, because it's so important. It's such a short space of time and we need to get as many businesses registered as possible. So do share within your networks. I hope this session was very useful. I found it incredibly helpful. And Ben, you did extremely well in answering all those questions. Your knowledge that you have developed in last 6 months is clearly very visible on that. So thanks for that. And I want to thank everybody for coming in this morning and for your questions and comments. Not only you were able to get your questions answered, but also a lot of these suggestions will actually feed back into the process and will improve the process. So it's incredibly important. So just before I say goodbye, all I would say is, look, I'm an entrepreneur by background. I came to London 19 years ago with almost nothing. I was able to build a successful fintech business and then became the deputy mayor of the greatest city in the world. And I'm incredibly proud to represent you all for last 5 years and helping you in whatever you're doing in becoming successful. And I'm so impressed by businesses, despite all the challenges that they've faced in the last 1 year. They've stepped up and they've helped other people and other businesses, and it's incredible, very, very moving. So I say to you, well done, everyone. And I've got full confidence in London and London's resilience. It's a huge challenge, but London has overcome huge challenges in the past, and it will do so again. I've absolutely no doubt in London's resilience and its ability to bounce back. And I know there's a bit of a sort of fashion to talk down cities and talk down London's in some circles. But I say to people anybody who bets against London will lose their shirts. So believe in London, as we all do, and we'll continue all working to make it a better city, a city that we love all so much and so dearly. So thank you, Ben, again, and thank you, everybody, and have a lovely rest of the day. Bye-bye.